What do people that are considering having dental implants placed overseas need to consider? And I think this is a really important point because we all understand here in Australia the dental profession is often more costly than overseas, particularly in the Asian countries, which increasing amounts of people are going to get dentistry, where the cost of labour is far lower than it is here. But also the regulation on the use of medical devices, particularly dental implants, doesn't exist like it does here. So the government does place a lot of restrictions on companies that import a lot of these medical devices for use in the Australian population at a cost, but it's really done to keep the population safe. And that's always the thing to consider about this sort of business, where a lot of stuff that gets done overseas are using implants that no one's ever seen before here. And there's been definitely cases where that's become a huge problem, particularly when they fail. So I suppose the thing you want to consider if you are considering going overseas to have some dental implants placed is really do your research, know a bit about the practice and what their training is, but also understand what products they're using and maybe make sure that the products they're using there are available for use here and those sorts of things. The thing from a local and a general dental perspective that we see here, and we tend to really only see the failures, is when things go wrong. And it's a very unfortunate situation where people get these jobs done overseas during a very short period of time while people are on holidays. These cases, particularly the bigger implant cases, are not a sit and forget. It's not like any other dental procedure we do. These cases need regular routine follow-up and checks, both in the short and long term. The big problem with overseas dentistry is that doesn't happen. We hear all sorts of stories from people going and getting their implants placed. They go back a month later because something's not right and the clinic's not even there anymore. And the big failures that we see is from lack of follow-up and lack of support moving forward. And then the unfortunate thing for these patients is this becomes a very expensive process to fix, far more expensive than what it would have been to do it the first time. And they're the big things you need to consider moving forward.